first, I'm really honored to be standing up here today with esteemed members of the President's Cabinet and his health team to make an important announcement with respect to the President's domestic promise to make America healthy again as we kick off the new year. In less than a year in office, the President and his incredible MAHA team have made real progress on this front. Here are just a few of the significant MAHA achievements thus far. More than a dozen food manufacturers and trade associations have made commitments to remove artificial and petroleum-based food dyes from their products. The Trump administration took strong action to bar hospitals from performing dangerous, irreversible, life-altering transgender procedures on children. The Trump administration announced funding awards to states through the Rural Health Transformation Program, an unprecedented $50 billion investment established under President Trump's One Big Beautiful Bill. The Trump administration has also worked with 18 states across the country to ban junk food purchases using SNAP benefits starting this year. And thank you for leading that effort, Secretary Rollins. Additionally, President Trump took historic action to secure most favored nation drug pricing and secured deals with major pharmaceutical companies to massively lower the cost of prescription drugs. And those effects are being implemented as we speak. Americans are going to continue to see the result of these incredible deals the president cut. And I know President Trump and this team behind me worked incredibly hard to lower those drug costs for Americans. On Monday, the CDC adopted common sense updates to America's childhood vaccination schedule based solely on the gold standard of science. This action empowers parents and physicians to make the best individualized decisions to protect our children, while also restoring much-needed confidence in our public health system. And as a MAHA mom myself, I'm very grateful for that. So thank you, Secretary Kennedy. To build on this progress, the Trump administration is now updating federal nutrition standards and guidelines to ensure that Americans have the most accurate, data-driven information supported by science and hard facts, not special interests or partisan ideology. President Trump has tasked two of the great individuals behind me, USDA Secretary Rollins and HHS Secretary Kennedy, with collaborating on this vitally important project. And today they are here to officially unveil the 2025 to 2030 Dietary Guidelines for America. These new guidelines are informed by the best and most reliable research on health and nutrition, particularly as it relates to the role of our diets and the prevalence of chronic disease in the country. They are also These guidelines are easy to read and understand, so every American, young and old, can access this information that literally has the power to change lives. But these are not just an updated guideline. These are the foundation to all federal food programs in our country. These new guidelines are going to update the food that is served to America's children in our public schools, to the plates that are served to our great men in uniform in our military, our veterans, and the food that they are consuming at the VA. And these new guidelines are also going to impact nutritional programs for the needy in our country, such as WIC and Head Start. Unfortunately, for decades, federal dollars has promoted low-quality, highly processed foods that lead to scores of long-term health issues, which means Americans have gone broke because of these health issues. Faulty dietary guidelines of the past stacked the deck against healthy eating and food options for everyday American families, which has fueled the chronic disease epidemic and jacked up the healthcare costs of households across the country. This failed approach in our public health system ends today. When these guidelines are followed, Americans will be saving themselves thousands of dollars. If we want to cut healthcare costs in our country, we must become a healthier country. According to the CEA, poor diet is the root cause of obesity, which accounts for $400 billion in medical spending each year. A healthier America will lead to a more affordable America. The new dietary guidelines from the Trump administration will ensure federal dollars go to real food to improve public health and therefore save the American people their hard-earned cash over the course of their lives. So with that, I am going to hand it over to Secretary Kennedy. The great people behind me will give remarks, and then we'll get into Q&A for the officials that are here on this specific topic. They will leave because they're all very busy people, and then I will open it up to Q&A with the rest of you on the rest of the news in the world. So thank you, and we'll start with Secretary Kennedy.
Thank you, Caroline.
Thank you.
Today marks a decisive change in federal nutrition policy, made possible by President Trump's leadership and the work of MAHA moms and public health advocates who demanded reform. Today, in accordance with President Trump's directive, Brooke and I will release the Dietary Guidelines for Americans 2025 to 2030, the most significant reset of federal nutrition policy in history. These guidelines replace corporate-driven assumptions with common sense goals and gold standard scientific integrity. These new guidelines will revolutionize our nation's food culture and make America healthy again. For decades, Americans have grown sicker while healthcare costs have soared. The reason is clear. The hard truth is that our government has been lying to us to protect corporate profit-taking, telling us that these food-like substances were beneficial to public health. Federal policy promoted and subsidized highly processed foods and refined carbohydrates and turned a blind eye to the disastrous consequences. Today, the lies stop. The new guidelines recognize that whole, nutrient-dense food is the most effective path to better health and lower healthcare costs. Protein and healthy fats are essential and were wrongly discouraged in prior dietary guidelines. We are ending the war on saturated fats. Diets rich in vegetables and fruits reduce disease risk more effectively than many drugs. Whole grains outperform refined carbohydrates. Added sugars, especially sugar-sweetened beverages, drive metabolic disease, and today our government declares war on added sugar. Highly processed foods loaded with additives, added sugar, and excess salt damage health and should be avoided. As Secretary of Health and Human Services, my message is clear: eat real food. Nothing matters more for healthcare outcomes, economic productivity, military readiness, and fiscal stability. The dietary guidelines shape dozens of federal feeding programs, including Head Start. These standards affect 45 million school lunches every day, meals for 1.3 million active duty service members, and food served to 9 million veterans in VA hospitals. Today begins the work of aligning those programs with affordable, whole, nutrient-dense food. Implementation requires coordination across the government. I'm working with many of my fellow cabinet secretaries to deliver results. I want to thank Bobby Mukamala, thank you very much, who is the president of the American Medical Association, for committing to mobilize the medical community on nutrition. And I thank also the American Academy of Pediatrics for partnering on this effort. I also look forward to working with Dr. Jay Bhattacharya and Dr. Marty McCary to fund and prioritize rigorous nutrition research at the NIH and at the FDA. The stakes are measurable and severe. A Johns Hopkins analysis estimates that 48% of every federal taxpayer dollar now goes to healthcare. The CDC reports that 90% of healthcare spending treats chronic disease. That means that 40%, 40 cents of every dollar that taxpayers pay in this country is going to treat diseases that could be averted through good food. The United States has the highest obesity and type 2 diabetes rate in the developed world. We spend 3 times more per capita than the European Union on healthcare, yet our life expectancy is 5 years lower, largely due to diet-related chronic disease. Our childhood obesity rate is 5 times higher than countries like France. 1/3 of U.S. teens have prediabetes, over 35% are overweight or obese, and 20% of young adults have non-alcoholic fatty liver disease. 77% of military-aged Americans are ineligible for military service because of diet-related conditions. If a foreign adversary sought to destroy the health of our children, to cripple our economy, to weaken our national security, There would be no better strategy than to addict us to ultra-processed foods. It's shocking that our own government helped to drive these cataclysmic changes in our diet. The damage is real, it is preventable, and President Trump has ordered it to end. If the United States reduced obesity, type 2 diabetes, heart disease, and Alzheimer's to Japanese levels, we would save approximately $600 billion a year. About 50% of Medicare's projected long-term deficit, or $5,000 per family annually. Current policy worsens the problem. 42 million Americans rely on SNAP, where common purchases include sugary drinks, candy, and chips. 78% of SNAP recipients are enrolled in Medicaid, and 90% of Medicaid spending goes to chronic disease. These incentives raise healthcare costs and undermine health. This must change. A new framework centers on protein and healthy fats, vegetables, fruits, and whole grains. And you can see the food pyramid here. It's upside down, a lot of you will say. But it was actually upside down before, and we just righted it. For the first time, the Dietary Guidelines directly address ultra-processed foods and set firm sugar limits in federal procurement, driving a significant reduction in added sugar in school meals. I want to thank President Trump for his leadership and the partners committed to ensuring that federal food dollars support real food and better health. Thank you. And I want to introduce my partner and friend, Brooke Rollins, who is an extraordinary collaborator on this.
Thank you. Well, good morning, everyone. Happy New Year. What a honor to be here. I think this is Caroline's first press conference back, and what a great way to start the new year, 2026. I want to thank Secretary Kennedy. Your commitment to the well-being of Americans is such a blessing to this nation. We have been working on these new dietary guidelines really since almost day one. Bobby and I were voted on the same day and sworn in on the same day. So I think the partnership from minute one has been real and extraordinary. As Secretary Kennedy mentioned, America is in the middle of the worst chronic health crisis in our nation's history. Over 40% of the roughly 73 million children in the United States have at least one chronic health condition, and nearly 90% of healthcare spending goes toward treating people with chronic disease. Secretary Kennedy mentioned that, but it is really important to keep underscoring that fact. This crisis is unacceptable. It prevents Americans from living healthy and happy lives. And for decades under both Republicans and Democrats, federal incentives have promoted low quality, highly processed foods and pharmaceutical interventions instead of prevention. As a result, nutrient-dense whole foods grown by America's farmers and ranchers have been increasingly displaced. The Trump administration is acutely aware of this danger, and today this announcement is making a major step in doing something about it. Thankfully, the solution is simple and should be non-controversial: eat real food. This is the main message of the new Dietary Guidelines for Americans 2025 to 2030, which encourage households and schools to prioritize whole, nutrient-dense foods. That means more protein, more dairy, more healthy fats, more whole grains, more fruits and vegetables, whether they are fresh, frozen, canned, or dried. We are finally putting real food back at the center of the American diet. Real food that nourishes the body, restores health, fuels energy, and builds strength. This pivot also leans into the abundant, affordable, and healthy food supply already available from America's incredible farmers and ranchers. By making milk, raising cattle, and growing wholesome fruits, vegetables, and grains, they hold the key to solving our national health crisis. And President Trump is mobilizing government to ensure families across America have greater access to these healthy foods. In the past 12 months, inflation has slowed and wages have risen for the first time in 5 years. Under President Trump's leadership, prices for everyday staples are declining and more help is on the way. Recent data show that fruits, vegetables, dairy, and proteins, including eggs, pork, and ground beef, are becoming even more affordable every day for our American people. American households enjoy the most affordable and abundant food in the world, and today's release only reinforces that reality. A healthy meal is within reach for all American families. These new dietary guidelines are a framework which is meant to be customized to meet the needs, the preferences, and the financial status of all American families. For example, a meal including such items as pork or eggs or whole milk or cheese, tomatoes, other fresh and frozen fruits and vegetables, whole grain bread, corn tortilla can cost today right around $3 for that meal. $3. And soon USDA will finalize our stocking standards, which means that those businesses in America that take the SNAP benefit, what they are required to stock in order to take that benefit, by the way, that's almost 250,000 retailers across America, that very soon we will be finalizing that rule that will mandate all 250,000 retailers in America double the type of staple foods that they provide for America's SNAP households. This means healthier options will be in reach for all American families, regardless of circumstance, at levels never seen before in our country. These dietary guidelines are foundational to so many USDA programs, and their introduction marks the first step in connecting America's schools and dinner plates to the best of American agriculture. Make no mistake, under President Trump's leadership, we are restoring common sense, we are restoring scientific integrity, and we are restoring accountability to federal food and health policy. The new guidelines are all about putting the well-being of Americans first, exactly where it should have been all along. This is the foundation that will make America healthy again, not just for those of us alive today, but for our children and our children's children and those coming behind. I want to end by saying God bless American families, God bless the American farmer and rancher, and God bless America. What an honor now to introduce another great partner in this incredible work, and that is Dr. Mehmet Oz. Thank you.
Congratulations to Secretary Rollins, Secretary Kennedy, and do want to express my appreciation for what the President has done overall to increase the affordability of health care. The biggest accomplishment perhaps for the health system ability to drop down prices last year was the most favored nation drug pricing that Caroline mentioned. These are incredibly effective at reducing the costs, for example, of what the President calls the fat shot, the Ozempic, GLP-1s category of medications. We dropped them dramatically. But the best way to reduce drug spend in America is to not need the drugs in the first place. What you're hearing today with these dietary guideline adjustments are going to be massively effective at not just dropping the need for us to buy these weight loss drugs, but buy the expensive drugs for autoimmune problems. We have evidence that food is medicine when it comes to conditions as varied as mental health issues from Alzheimer's and depression to fundamental realities of how children learn in school. So the question then becomes, what is this actually going to do in dollars and cents? And I had the group at CMS run some numbers for us to try to give you concrete assessments of how much this will drop the spend that the federal taxpayer must make for Medicare and Medicaid. And I'm more optimistic today than ever that we can address the fast rising rate of healthcare expenses in America because of movements like this. Right now, we're increasing health expenditures in America at roughly twice the rate of the GDP growth. We will correct that if we can get America to be healthier, because you can't be a wealthy nation without being a healthy nation. So 2 numbers for you to remember. The first is $30 billion. Why? 30% of healthcare costs are directly attributable to obesity. I'm not talking about indirect associated expenses, which are also present, but a very conservative number, 30%, are directly attributed to obesity. That's about $300 billion a year for just Medicare, If we were to affect obesity by 10%, which is an incredibly conservative and justifiable assumption that has been borne out in evidence-based dietary experiments, and trials. Just that alone is $30 billion of reduction of expenses for Medicaid, for Medicare rather. That's also obviously correlated with Medicaid reduction in spending.